So today I'm talking about brain inflammation. And brain inflammation is something that is often mistaken for just so-called natural causes of stress and hormones and aging. People often will have cognitive problems or memory issues or brain fog, just feeling like their thoughts are fuzzy. And just be told, oh, that's just a normal part of getting older, or that's just PMS, or you're just stressed out. But the truth is that these are signs of an inflamed brain, and they are absolutely preventable, and the root causes of the inflammation can be addressed and these symptoms reversed. So you do not have to accept these as just a normal part of life. Now, the brain gets inflamed through an immune response. So we have a immune system that fights, viruses and pathogens and toxins, and our brain also has an immune system. And when our immune system is overloaded, the immune system in our brain can also get overloaded, and this creates long-term inflammation. Now, inflammation is really important for the immune system because that's how it addresses these short-term threats, right? Like you get a cold, your immune system causes inflammation, your body fights the infection, and then ideally you can return back to a good baseline. The problem is when these issues become long-term. There's something going on that your body is having a really hard time dealing with, and so the inflammation becomes chronic. And when inflammation in your brain becomes chronic, you can start to get these symptoms like I was talking about before, of cognitive issues, kind of a feeling of just having not a lot of mental endurance, not a lot of stress tolerance, your thoughts running kind of slow or being kind of fuzzy, a hard time focusing, fatigue, and then even things like depression, anxiety, OCD, even things like bipolar, psychosis, and tics, different kinds of neurological movement disorders. These can all be the result of a chronically inflamed brain due to some issue happening long-term in the immune system. So we've identified that brain inflammation is from some kind of immune response, but what causes that immune response? So there are 5 things that I'm going to talk about today that should be addressed directly in order to get to the root cause of the brain inflammation that could be causing your symptoms. So the first one I want to talk about is blood sugar dysregulation. So the cells in our brain need glucose, and that can either be gotten through the food we're eating or created in the liver through gluconeogenesis. Our brain will get some source of sugar no matter what we're eating. Now, the problem is when maybe that system is not functioning very efficiently due to some issue in the metabolism or because of a dietary issue. So if the brain either doesn't get enough sugar or gets too much sugar, it's going to kind of go into shock, and the immune system will be suppressed, leaving it vulnerable to other issues. So this is kind of like when you eat a lot of sugar, you're more likely to get a cold. Like if you binge on candy and then you're exposed to a virus, you're more likely to get it because the kind of shock your body goes into when the blood sugar is dysregulated can really affect the capability of the immune system. So some types of brain inflammation that could just be related to blood sugar dysregulation are irritability, brain fog, low energy, anxiety, and mood instability. If you just feel like your mood is really unstable, you can never predict how you're going to respond to something, or you go from really high to really low, maybe not quite to a kind of bipolar status, but just really unstable and erratic in your mood. And then there are some other physical signs that could corroborate that issue, although some people just have the mood symptoms. So if you notice that when you go for more than a few hours without eating, you start to get a headache, or you feel shaky or lightheaded, Or on the other side of things, you tend to not have an appetite in the morning, like you get really nauseous and anxious in the morning and it makes you not want to eat. Those are more signs that maybe your blood sugar is dysregulated. But the good news is that this is actually one of the simplest root causes to correct, because if you are able to just balance your blood sugar through your lifestyle practices, then the immune system in your brain will come back online and a lot of these symptoms will start to go away. So making sure you are eating breakfast is something that can be really helpful. Even if you feel too nauseated or anxious, that's actually a sign that your blood sugar is too low and you really do need to eat. Even it could just be like a nibble of something just to get your metabolism going. And really trying to focus on fat and protein for breakfast can be really helpful. So instead of like your oatmeal and fruit, to eat your bacon and eggs. I also suggest when you're eating throughout the day, snacking or meals, that you don't do naked carbs. So you don't ever eat a heavy carbohydrate food without it being paired with some kind of fat or protein, because that's going to help your body metabolize those sugars a little better. So I don't recommend things like dried fruit or fruit juice, obviously things like candy or pastries, or even things like crackers. I do not recommend those as snacks. So, if you're going to have a bowl of rice, have it with some chicken. If you're going to have some fruit, have it with a piece of cheese or a couple tablespoons of nut butter, something like that. So the second cause of brain inflammation would just be poor circulation. So if our immune cells can't get to our brain through our bloodstream, then it's probably going to cause some inflammation in the brain, because the immune system in the brain is then going to be struggling, not getting enough nutrients and resources and oxygen to function well. So again, this is one of the simpler ones to correct. This can be related to a breathing disorder, a breathing problem, not breathing properly, so just not physically getting enough oxygen into your body. Blood pressure that is too high or too low could also cause this. And then also, adrenal stress can cause low oxygenation, just your body being in this constant kind of stress, fight or flight mode from the dysregulated cortisol. So if you have poor circulation to your brain, that inflammation might manifest as, again, the memory or cognitive issues, brain fog, the fuzzy thoughts, things like that. It's really going to be related to just not feeling like you can really think straight. Some other things not directly related to the brain that could corroborate this is an issue for you would be if you have chronically cold fingers, toes, or nose. Or if you've had chronic issues with fungal growth on your fingernails. Again, that has to do with just not enough immune cells being able to get into those far parts of your body to be able to address those issues of chronic infection. So again, chronic poor circulation is one of the simpler things to address. A lot of it just has to do with implementing some basic lifestyle practices. So learning how to belly breathe is a really big part of this. So just learning how to breathe properly. And a lot of people don't know how to stimulate their diaphragm properly to breathe. So it definitely takes some practice to build up the muscle tone and muscle awareness to be able to do this. We want to avoid breathing into the chest and breathing deeper into the belly to really get a full dose of oxygen. So doing some deep belly breaths first thing in the morning can really help get your breathing pattern on the right track for the day. And then exercise is another great way to boost the amount of oxygen you're getting into your body, but it's a very specific type of exercise. So it's short bursts of intense activity. So if you're going to do some kind of movement in the morning to get your circulation going, it would be like 5 to 10 minutes of sprinting or a few circuits of high intensity interval training. Not enough to really fatigue you, but just to really get the oxygen flowing in your body. And then again, adrenal issues can really be related to poor oxygenation because of how it can affect blood pressure. And so just being mindful of your daily stress levels. Adrenal fatigue is a pretty big topic we won't be able to address right now, but making sure you're engaging in relaxation practices, eating a balanced diet where your meals are timed regularly throughout the day, and sometimes taking some supplements for adrenal fatigue can be helpful as well, such as the glandular supplements, the bovine glandular supplements to support that that gland can be helpful. So the next issue would be food intolerances, and food intolerances are definitely an immune system issue. So if you obviously you can be allergic or intolerant to any food if the immune system has decided to identify it as a threat. And so if you know that you have a specific food intolerance, even if it's a mild one, it's really important to always make sure that you are avoiding it. Because even if it's just a small effect, like, oh, I'm intolerant to dairy, but it just gives me a runny nose, so I eat it anyway. But that runny nose is an indication that your immune system is getting stimulated, and if you do that frequently, it's going to cause inflammation in your brain and start to cause symptoms. And so it's really important that even if you have a mild intolerance, that you really avoid that food. Some intolerances can be healed through kind of a gut healing or leaky gut diet, which I'll talk about in a minute. And so that's great if you're able to do that, but definitely avoiding food intolerances is important. And then there's other foods that just kind of have such inflammatory compounds in them that even if you're not acutely allergic or intolerant to them, it's just really helpful to take them out of your diet to see if it can calm your immune system down and quell some of that inflammation. So, I mean, some of these are items that really shouldn't be in anyone's diet. They're not actually food, and so they're just really agitating to the nervous system and can cause inflammation that way. So this is, refined seed oils like canola oil, soybean oil, things like that. Any kind of artificial sweetener, artificial or natural flavorings, colorings, preservatives, emulsifiers, like anything that looks like it has like a chemical sounding name or has numbers or letters in it on an ingredients list. And then there are foods that are technically whole foods, but because they have been introduced pretty recently in human evolutionary history, and they have been really modified by genetic modification and industrial processing and pesticide use, a lot of people have an inflammatory response to it. So this would be any kind of gluten, so wheat, barley, spelt, oats, things like that, soy, corn, and pasteurized dairy. It's really important if you're going to experiment with eliminating these foods that you do it 100%, because if your body is having an inflammatory response to it, even a small amount of that food will keep that response going, so you won't be able to tell if it's actually having an effect. So I recommend at least 4 to 6 weeks of completely eliminating some of those foods, all or some of those foods. You can decide how you want to approach it and see if it can help quell some of these symptoms. Symptoms often related to food intolerances would be things like, again, brain fog, learning disabilities, like the really difficulty focusing or comprehending things, aggressive or irritable tendencies, compulsive behaviors, panic disorders, and then child behavioral issues if you have a child that's just having a lot of tantrums or has a really hard time following directions or just seems to be really hyperactive or agitated a lot of the time. This is a very common cause of that. So the next one would be chronic gut infections. And so you can see how this is directly tied to the immune system, but it's also tied to the brain's immune system because we have this gut-brain axis. So we have this direct connection between the gut and the brain through the vagus nerve. That's how we get information from our organs and our digestive system into our brain for processing, and we send information back down as well. And so these two immune systems are always talking to each other. And so if there's an issue going on in the gut, it actually is going to often express in the brain. And in fact, sometimes when people have these chronic gut issues, they are only manifesting in a cognitive or neurological way. And so it can be really confusing when you're having these neurological symptoms to think that the root cause might actually be in your gut, in your digestive system, but that's actually very common. So again, brain fog, fatigue, depression, these kind of behavioral issues in children I was talking about before, anxiety and panic, and then things like OCD and tics like Tourette's, things like that can also be from a chronic immune response happening in the gut from a chronic infection that is going up into the brain. Now, again, not always does this happen, but there can also be other corroborating symptoms that relate to digestion. So if you get heartburn or acid reflux, if you tend towards constipation or diarrhea, just not very consistent or smooth digestion. If you have bloating after you eat, or you notice that you're not digesting your food totally, like you have undigested food in your stool, these are all signs that there's some pretty significant imbalance happening in your gut. So this would be issues related to an overgrowth of bacteria, yeast, or parasites generally, which are actually pretty common, and a lot of the times just a processed food diet growing up, or use of antibiotics or other kinds of medications can compromise the gut lining and cause these infections to take hold. And so the best way to go about this, to heal this, is a pretty involved nutritional protocol, like a gut healing or leaky gut diet. And it is very restrictive, but it's not a lifetime commitment. It can be done short term, 1 to 6 months, and it can make a really huge difference in your immune system's ability to fight infection. And basically it just goes in and eliminates all the things that these pathogenic microbes might be feeding on, which is generally sugar and starch. And so I'm not going to have time to go into the details of it right now, but you basically base your diet around meat, animal fats, low starch vegetables, and small amounts of low sugar fruits, like mostly just berries. So you eliminate all processed food, grains, legumes, nuts, seeds, starchy vegetables, and then the higher glycemic fruits like apples, pears, things like that. So it is pretty intensive, but it is extremely effective. Other things you can do is just make sure that vagus nerve is stimulated, that brain-gut connection is stimulated, to try to get your nervous system in your gut really active and working on healing these infections. And so vagal tone exercises, such as humming really loud or gargling really vigorously or even inducing a gag reflex, can all be helpful to just kind of get that nerve active and stimulated. And then there's targeted supplementation you can do. L-glutamine, marshmallow root, and soil-based probiotics are generally what I would recommend if you're trying to work on gut healing. So the last cause of brain inflammation would just be other kinds of toxic overload. So it's not just gut infections that can create this immune response of these organic pathogens, but it could also be these other chemical compounds, generally man-made ones, such as fragrances and other chemicals found in hygiene and cleaning products, plastics, pesticide exposure, any kind of like occupational chemical hazard you would encounter, and then heavy metals as well. Now, we're all exposed to these things all the time, but some people have more of an intense immune response to them than others. So this would look like people who have chemical sensitivities, often things like migraines, chronic pain, sensory sensitivity, but then also things like depression, brain fog, memory issues as well. Other indications might be if you have things like asthma or chronic skin issue. This could be an indication that you have some toxic overload. Now, the interesting thing about this is, why do some people have these stronger responses to these substances and others? Two people will be exposed to the same toxin, and one might develop these symptoms of brain inflammation and one people won't. And it really has to do with how well your immune system is functioning already. So we use a compound called glutathione in our cells to detoxify. Our immune system is constantly using this compound to kind of flush out any toxins we encounter. And so if you are already glutathione deficient for any reason, and there can be a whole lot of reasons why people might become glutathione deficient early in their life. So if you already have that deficiency and then you are exposed to a toxin, your body is not going to have the resources it needs to deal with that. And so that's when these symptoms are going to occur, as opposed to someone who already had a large amount of that compound in their body and then were exposed to a toxin and their immune system just took care of it. And so you really want to address immune health by boosting these glutathione levels. And there are really great targeted supplements that you can use, things like NAC, N-acetylcysteine, alpha lipoic acid or ALA, L-glutamine again, And then some plant compounds actually help boost it, like cordyceps, the mushroom, and milk thistle. Now, I would recommend going back to that leaky gut diet if you are dealing with any kind of toxic overload, because that's also going to help boost glutathione levels in your body, even if it's not directly a chronic gut infection that you're dealing with. And then other supplements you can use, vitamin D levels and omega-3 levels are really tied to glutathione production and immune system health. And so making sure you're getting sunlight, eating seafood regularly, supplementing with cod liver oil, things like that can be really helpful too. So, I just could do a really brief overview of brain inflammation and how it relates to immune health and all the things you can do to start to address the root causes of brain inflammation. But I do really recommend the book, Why Isn't My Brain Working? Because the doctor who wrote it really goes into a huge amount of detail about each of these topics and really describes exactly how brain health and immune health are connected. And he also has a lot of really specific protocols and testing for things like gluten intolerance and autoimmunity as a result of brain inflammation. Just really a wealth of information on also like neurotransmitters and gut health and insulin resistance, all of these factors that we just kind of touched on today. So if you want more information on any of these things, I really recommend checking out that book. But I think the most important take home from the book and what I'm hoping to communicate today is that all of these cognitive and neurological symptoms that a lot of people just take for granted have an identifiable root cause. They are not just normal side effects of being stressed out or, being hormonal or aging. They are identifiable and they are reversible. We just have to do some targeted treatment. So I hope this really inspires you to take your brain health into your own hands.